response. We are just connecting with Dr. Wilkinson. He had a little bit of emergency, but now he's on. I'm Amber Brooksher, the Director of Community Relations at the Kensington Sierra Madre. Kensington is very happy and glad to partner with Dr. Wilkinson. And we just want to thank him in advance for supporting our ongoing efforts to raise this kind of awareness and be a resource to our community with his expertise.
Great. Can everybody hear me?
Yes.
Good. Well, glad to be chatting. I did a talk like this on stroke. I don't know, it was maybe a year or two ago, but we were of course at the Kensington. We got to use the wonderful rooms they have there for the talk. But I look forward to Zooming with all of you tonight and talking about different forms of dementia. Okay, so this is I think one way to think about dementia is, in a sense that the lights are on but nobody's home, in the sense that you know and can respond to your external stimuli, but processing the information, remembering what's been going on, that's very difficult for the dementia patients. Let's talk about the term dementia. It's kind of like saying, if you say the patient has dementia, it's like saying you drive a car. So there's different types of cars and there's different types of dementia, okay? So dementia is like driving a car, and there's different cars, there's Fords, and there's different brands and different things. So just remember that concept, because we're going to go over some of the different forms of dementia depending on what part of the brain is affected. Okay. Can everybody hear me?
Yes.
Mm-hmm. Nod your head. You just kind of go.
Yes, sir.
You can nod. I've got all these speakers. We can see you. Okay, so let's chit chat here a little bit about one of the most common forms of dementia, which is called Alzheimer's disease, named for the neurologist who first described it. And this is something that focuses in the temporal lobes, the sides of the brain. Now, the temporal lobes are very much involved with memory formation. So when you have Alzheimer's disease, it tends to affect the memory, first of all, in terms of making the new memory concepts, the short-term memory. It doesn't so much affect the long-term memory, at least not in the initial stages. So you'll remember a typical Alzheimer's patient will have difficulty remembering, say, what they had for breakfast, what people talked to them about in a meeting, what people called them about on the phone, all within the past day or two. But they'll remember where they went to grade school, they remember where they went to high school, they can remember the distant memories. So they say, well, doctor, I can still remember from the past, it's just the current that I have a problem with. And that's because the temporal lobes are very active areas of the brain. And when you start to lose your temporal lobes, you know, the temporal lobes are part of the brain that makes new brain cells. I don't know if you know that, but you have actual parts of the brain that make new brain cells, and one of which is the temporal lobes. So the temporal lobes are making new brain cells, ostensibly then, to make new memories. So they're creating new proteins, storing them away so that you can remember new things. So when you affect the temporal lobes with that, that's the Alzheimer's disease. And of course, the Alzheimer's disease can be progressive. It is a progressive disease, excuse me, it is a progressive disease. And the speed at which it progresses varies from individual to individual. Now, unfortunately, there is a genetic predisposition. If both your mother and father had Alzheimer's disease, then yes, you'll be at greater risk to have Alzheimer's disease. However, sometimes it occurs just spontaneously where it just affects people. Now, there's a statistic out that if you live to be 95, you have almost a 50% chance of having some form of dementia or memory loss if you make it to 95. Now, since I plan to live to be 110, I'm obviously very concerned about these problems and these disorders. Now, granted, my father made it to 93, mom made it to 89, both in pretty good health. They died of heart attacks, but nevertheless, I'm still concerned about this entity because, as I said, living to 110 puts me at risk. I'm not anywhere near that right now. I'm 64, but you know, it's still something that I have a personal interest in. Now, as far as treatment of the Alzheimer's disease, we've been hopeful, but there has not been the breakthrough that we would like to have. We have medicines that are generic, which means they've been around for at least 6 to 7, 8 years. That's called donazepam, or the trade name Aricept. We have memantine or Namenda. And they both raise the level of what we call memory chemicals. There are two chemicals, acetylcholine and then NMDA. which are used to help store memories. And by taking these medications, you increase the levels of the acetylcholine and the NMDA. So basically, there's more for the brain to work with. Now, these are only temporary. They work anywhere from 2 to 4 years, depending on the individual, but they're not a cure for the disease. They just simply help stabilize. And in some patients, the early stages can actually give some improvement in terms of the early cognitive function. So oftentimes we'll start people on Aricept or donazepam. It's a generic drug at 5 milligrams a day, going up to 10 milligrams a day. The side effect mainly is diarrhea if you're a tendency that way. If you're constipated, then it's a great medicine. There's no issue there. And then when we establish that, then we can add on the Namenda and establish that and have sort of a 1-2 punch. And then there is a name brand medicine that combines the two together. Your Aricept and Namenda together, and it's a name brand drug, but you could just take the one pill, and then that's kind of convenient for some people. However, for most people, the Aricept is a $5 copay, and the Namenda is a $5 copay because they're generic drugs. So some of my patients who are on limited budget just choose to buy them individually and take them. But there is a combo pill that is a name brand drug that you can use, and it's called Namzeric, which works just fine, and it'll take care of it both for you in case you're for that kind of issue. I'm very cognizant of the fact of the cost for my medications for my patients. It's no good for me writing you a $5,000 a month drug that you can't afford. And there's literally a number of anticonvulsants, things like that do cost $4,000 to $5,000. So I have to be very cognizant. I try to use the generics first and get the maximum benefit before turning to name brand drugs for my patients so that they can get the most from their Medicare dollars and other plans too. Okay, so we've talked about the two drug treatments, the Namenda and the Aricept, or the memantine and donazepam, which is treatment for Alzheimer's disease. Then I want to move on. We're kind of moving along as far as the diagnosis of how do we diagnose an Alzheimer's patient. We start with a history, which is of a short-term memory loss with preservation of long-term memory. And then we move on to, so we may scan the brain, get an MRI or CAT scan of the brain, just to be sure there's nothing else up there, a subdural hematoma, bleed in the brain tumor, et cetera, et cetera. So we get an MRI, then we get blood tests. We check the B12 and folate levels because these are vitamins that are critical to proper brain function. Now the B12 is a kind of an interesting medicine. It's a vitamin, and it's in vegetables and green vegetables and things like that. Some types of particularly the green leafy vegetables have a bit more B12 in it. The interesting thing is as we get older, or more mature as I like to say, sometimes we can't absorb the B12. It just can't get through from the stomach into the blood. We stop making an important factor. It's called the intrinsic factor, which will take the B12 from the stomach, transport it across the membranes into the blood. So it doesn't matter how much B12's in you, you can't absorb it. Similar to the problem that develops with people who've had milk intolerance as they get older. They just cannot tolerate the milk, and then they don't have the enzyme necessary to break it down. So they have to give up milk. Well, the same thing can happen in people who, despite having vegetables for every meal, besides taking multiple vitamins, will have a B12 deficiency. And so those will come either through a sublingual capsule under the tongue or just a monthly shot, which will also take care of it. That's for the B12. The folic acid is more just a question of taking a supplement for that. We also check to make sure you're not anemic, that the reason that you're not remembering is because you've got some form of cancer, malignancy, or anemic, that sort of thing. That's the CBC with diff. We check your liver and kidney function to make sure you're not going into early kidney or liver failure, because if those organs are affected, they can affect the brain. Obviously, your kidneys are removing the poisons from your body. If they're not working, then of course you may become confused. Same with the liver. So we're checking a comprehensive metabolic panel, we're checking a CBC, and then we're checking the B12 and folate levels, and also checking a thyroid panel pretty routinely to make sure you're not hypothyroid. Hypothyroid is the state in which your thyroid is not producing enough, maybe because of age or one other factor. And as a result, you don't think straight. And you find yourself being weak and tired and very cold and heat sensitive to temperature sensitive. That's often with the thyroid disorders. So those are the common things we check: history, an MRI scan, check the blood tests, and then we would begin the treatment. If we thought it was Alzheimer's disease, we would begin the treatment. Now, what would we expect to see on an MRI? Initially, the MRI scans on Alzheimer's patients are normal. Over time, the temporal lobes will start to shrink. The temporal lobe of the side, you can actually see the temporal lobe shrinking because of the breakdown of the tissue in there. And there's different forms of pathological things that go on in there, neurofibrillary tangles, things like this. Now, there's a very interesting study out of China recently that say that the Chinese who drink green tea, you know, the green tea leaves, the real thing, you know, not black tea, but green tea, have a decreased incidence of Alzheimer's disease compared to people who drink just the black tea. Now, in China, they like to drink their tea hot, never cold. And they take a lot of pride in their tea leaves, and particularly the strong green tea is what they believe. And they're speculating it has some antioxidant factors that will help fight off Alzheimer's. There's just a recent paper out of China that talked about that. So people will be looking at that some more. I personally have had a little green tea. I get a little bit of green tea 2 or 3 times a week just to make sure. Of course, in our area here, there's many fine tea shops where you can go in and buy being in the Asian community, you can buy the teas, but at least before COVID. But you can get the green tea. It's just an interesting article. You can Google it and say green tea and Alzheimer's disease and see the most recent article. I find it interesting. That's kind of interesting. Now, we have different research projects that are going on trying to treat Alzheimer's disease, because obviously, if we were to find a cure for Alzheimer's disease, we may empty anywhere from 20 to 50% of the beds in the nursing homes, that people would be able to go home because they wouldn't have the disease. Now at the Kensington, of course, there's a lot of very excellent care that goes on to benefit the Alzheimer's patients so that they can live the most that they can in a very supportive environment. That's part of what the Kensington's mission is to provide a supportive environment for patients with dementia and with the Alzheimer's disease, because they need a lot of support. So we won't close the Kensington any too quick, because so far the studies have been, shall we say, less than successful. We're always hoping that something will come through. Currently, I should tell you that a lot of the research dollars that were going into Alzheimer's and other entities have all been transferred over to COVID. So the COVID is taking up a majority of the research grants at this particular time. The government can shift the money, and they have. So there's been some ongoing research which continues, but a lot of the what about this idea stuff has been put on the back burner while they fight COVID. So as far as government support, private industry has spent billions of dollars without success, so they're kind of waiting for somebody else to come up with an idea, and then they'll market it. There's some startups, some small companies that think they have some innovative ideas. As I said, unfortunately, COVID is a terrible thing, but it is absorbing the research money, that some of which would go into Alzheimer's and other neurological disorders. But that's just the way it was until we get a grip on COVID. Let's talk about another form of dementia or memory loss, and that's called multiple infarct dementia. That means you've had many small strokes deep in the brain. Now, it's also named for another neurologist by the name of Dr. Binswanger. Binswanger, that's his name. He was, I think, a German neurologist who came up with this idea of having checking brains. And that is that over a period of time, when you have a number of small strokes deep in the brain, you can lose memory. Now, while the Alzheimer's is a more progressive time of deterioration, Binswanger's will kind of come along for what's more like a step, because every time you have the strokes, you lose a little more brain. You kind of, it's like going down a step of stairs, going down stairs.
To a lecture.
Sorry? Yeah, so this is what we call with the Binswanger's disease, the multiple infarct. Now, it turns out when I was in med school, we were basically taught back in the 70s, and well, I graduated in '83 from med school, but we were taught that dementia was from Alzheimer's disease. That was what it was. It turns out that actually majority of the patients who have memory loss have a component of a mixture of different types. They have some multiple infarct dementia with the Alzheimer's disease, or multiple infarct dementia with one of the other disorders. So in other words, these small strokes do build up in the brain. Now, the interesting thing is that there are lots and lots of studies that say there are things you could do to prevent strokes. That is, you can make sure your blood sugars are well controlled, your blood pressure is well controlled, your cholesterol is well controlled through medications or diet or combination. You can eat a Mediterranean diet. You can exercise regularly. These are all things that you can do that are very, very effective in preventing strokes and in preventing the small strokes, which lead to the multiple infarct dementia, which leads to your memory loss. So when people tell you to eat a heart-healthy diet, eat Mediterranean-type foods, get some exercise, don't smoke, these are all things that really will affect the incidence of stroke and the incidence of the small strokes, which lead to the Binswanger's disease. So I'm a big fan of those individuals who speak in favor of lifestyle, because we want to prevent it from ever coming in the first place. And if you remember that most patients that you see with dementia have a combination of Alzheimer's with multiple infarct dementia, frontal temporal dementia, which we'll discuss later about some of the other types of entities. So that's something you can do something about. You can start right now and being sure that you do these things. Now, one of the most important factors that they're talking about now, besides the good diet and exercise, is sleep. So going to bed, getting your 8 hours, your necessary sleep, apparently is a good way to try to minimize the dementia, the Alzheimer's, and the multiple infarct dementia. Because what happens when you sleep is your brain gets a really good bath. Think about your brain settling into a nice hot tub at the end of the day. It's just sort of floating there in the tub, and it's getting some washing done, and people are coming along with a little brush to kind of give it a little brush here, there, and everywhere. And literally your brain, as you get into deep sleep, that's not the first 4 hours, but it's the next 4 hours. Not the 8 to 12, but the 12 to 4, 12 to 5, that's a deep sleep. Your brain shrinks, and then literally, and then the fluids mix around with it, and they bathe it, and they clean it, and they make you ready for the next day. It's kind of like when people don't get enough sleep at night, it'd be as if you never cleaned your office. You never had the trash taken out. Nobody came by and picked up the coffee cups. After a while, things get cluttered, right? Same thing with the brain. You've got to get to sleep at night. The big purpose of sleep is to clean your brain. So you get in there, you're in your deep sleep, your brain kind of shrinks down, the fluids flow all around into the areas, into the cavities. They kind of go in there with little scrub brushes and scrub out this and scrub out that and kind of lubricate things. It's like your maintenance team that comes into a building at the middle of the night or something like that and really just makes it ready for the next day. So then you wake up fresh and ready to go. But if you haven't had any sleep the night before, you've been up, you've only had an hour or two of sleep, your brain is cluttered. It hasn't had a good cleaning. Because if you stop taking showers or stop taking baths, after a while, people would say you need to take care of it. So that's why it's so important to get your whatever it is, your 7 or 8 hours of sleep at night. And if you can't because you have sleep apnea, because you're choking on your throat at night, deep in sleep and stuff, you need to get some treatment for that so that you can be enabled to get your good deep sleep. It's not the first 3 to 4 hours, it's the next 3 to 4 hours after that. That's the deep sleep that you need to get. Also, if you're getting up 4 to 5 times a night to go to the bathroom, you're not getting any deep sleep. There's no way you can. Average man my age might get up once, but they'll go right back to sleep and then go back into the deep sleep. That's okay. But if you're getting up 4 to 5 times a night, I don't know how you can possibly be getting any deep sleep. Anyway, that's part of my digression here. So we've talked a little bit about Alzheimer's disease. We've talked about multiple infarct dementia. Let's talk about another one, FTD. There used to be an old company that distributed flowers, FTD. That's how I remember it. And it's called frontal temporal dementia. It hits the frontal lobes, it hits the temporal modes, and it can cause a combination of some memory problems. Now, the frontal temporal dementia can often manifest itself through behavioral issues. It's affecting your frontal lobes. Your frontal lobes control your behavior. So suddenly you're making inappropriate choices. You're buying properties you shouldn't. You're making business deals you shouldn't. You're just not the sharp businessman you were before. And then the temporal lobe means that you may have problems with speech. You may not get out the correct word. You're having some word finding difficulties, making bad decisions. That's the frontal temporal dementia. Over time, you'll see atrophy in the frontal lobes, atrophy in the temporal lobes. And that's what sometimes can turn up. Now, some people don't realize they've got Alzheimer's disease is kind of more recognized by individuals because the short-term memory, keeping the long-term memory, but the frontal temporal dementia is a bit more insidious. It kind of creeps up on people. Suddenly they can't make the right decisions anymore. Suddenly somebody's calling on the phone saying that their cousin is in jail and needs $50,000 and they're going down and sending him the money, things like that can happen with the frontal. Or you get these businessmen who suddenly lose it, okay? Who suddenly become inappropriate, make inappropriate remarks, do things they shouldn't do. And then they're eventually diagnosed with frontal temporal dementia because they still have enough memory to recognize who they're talking with, things like that, but they're just being inappropriate and they're just making bad decisions. Sometimes these people own basketball teams or sports franchises and people are uproar about them until they're designated that that's what happened. You know, they had frontal temporal dementia. And then that's just not anymore. So that's the kind of decision-making thing that just would be considered inappropriate. So that's frontal temporal dementia. Then there's a dementia associated with Parkinson's disease, a Parkinson's dementia complex. So some of the Parkinson's patients, not all of them, but some of them, although Parkinson's is often a brainstem problem. There's an area there of the brainstem called the black area, BLACK, or substantia nigra. And it looks black on stain when they do the stains on the microscope and look at the brainstem. If you want to look at somebody's brainstem, you need to pickle it first. You know, like you can take a cucumber and make it into a pickle. Basically, you take the area that you want to look at, you put it in a brine type substance, and after about 5 days, you can take it out and it's been dyed and brined, and then you can slice it and look at it on a microscope. And when you do that, the area looks black, so it's called substantia nigra. And it's in the brainstem, and it's the Parkinson's disease is really a question of helping with the on-off type effects. You have some chemicals that help you modulate between stop and start, stop and start. And the problem is with the Parkinson's disease, you have degeneration in the area that starts to stop, the start area. So you tend to stop a lot. Parkinson's disease is all about stiffness, rigidity, facial stiffness, tremors, shaking, but it's all about not being able to stop and start appropriately. And then we give you medicines to try to soothe that up. But that's another lecture. But there can be a dementia associated with the Parkinson's disease. Then there's also some other things called Pick's disease, which is a different type of entity which affects some of the deep nuclei in the brain. Then you have some dementia associated with chronic alcohol use. Alcohol is a bit of a toxin. And if you drink it on enough basis over a prolonged period of time, people will develop what's referred to as an alcoholic dementia. They lose memory, they lose function, they lose, it can affect major portions of the brain. And that's called an alcoholic dementia, something like that. Unfortunately, can be difficult to reverse. And that's another form of dementia that you have. And then you have associated with infections of the brain. There's originally an AIDS dementia, where people start to lose their memory from HIV. Then there's sometimes dementia associated with chronic liver or kidney disease because of the toxins building up in the body. So you've got the concept here is that you try to keep your brain clean by getting plenty of sleep at night, but you also have to keep your liver and kidneys in good shape, which is why you want to avoid the alcohol, which with its possible complications on the liver and kidneys. Of course, you know, in small amount, I mean, you might as well drink grape juice, but if you have a small portion of wine with dinner, that's probably good because of the flavonoids in the, which is those fancy chemicals in the grape juice. But you can also get it from just drinking some grape juice or eating grapes or eating blueberries, something like that. You get the same effects. But alcohol is a slippery slope. You start getting on it and it's a toxin. I mean, that's why they clean stuff with alcohol. You know, rubbing alcohol is a cleaning material. It's toxic to the brain beyond certain points, and you lose a certain number of brain cells from the chronic alcohol use. And then there's sort of the dementia pugilistica, which is what the prize fighters would get from getting hit in the head so many times. You know, taking too many head blows, and that develops. It's sort of a multiple impacted thing, and that's been expanded. It was first found in boxers, but found also in football players who take a lot of blows. The football players, particularly those linemen, those big heavy people in the middle who are trying to stop people coming, they'll sometimes take blows to the skull and head, you know, frequently, and they frequently get concussions. They always used to get concussions, and they just played through it. They were strong, they kept playing through it. Unfortunately, that caused a number of micro trauma, which builds up in time. And they made a famous movie about the doctor who first discovered this, Will Smith did, made a movie about it, and it plays on cable. So it's all about that. It's a constant trauma to the brain. And this can cause a dementia, memory loss, and also some behavioral problems, some very severe behavioral problems. So some of the older NFL players have been suffering from it. And some of the college players actually have suffered from it too. And then you come down with dementia in your 30s, people have to ask those questions. So, and that has a certain microscopic appearance when they do check the cells in the brain itself. So you've got a sort of multiple infarct dementia there, and a sort of multiple trauma dementia. I was taking care of some football players who, as a neurologist in the community here in Arcadia, were sent over from their local colleges. And I got MRI scans, and I was really shocked to see what kind of trauma I picked up on the brain. There had been people who had some significant brain bruises, and I could see where previous brain bruises in the brain, what I can see. And I'm no doubt some of those people I saw and diagnosed and said you shouldn't play football anymore are going to develop this multiple dementia later in life. So unfortunately, you know, when I watch football, it's a bit of a guilty pleasure there. I enjoy the sport. I enjoy seeing men who are 250 to 300 pounds move gracefully through the air like ballerinas, or you know, they've got them trained so well. But the thought of the head blows and the head trauma really kind of takes some of the fun out of it for me. I guess that, you know, the NFL players, they've made a bunch of rules that says that people can't hit head to head anymore. They're trying to minimize this. They try to work to make it a safer sport so as to minimize the effects. I wouldn't want the money. You know, if you're going to pay me $1 million or $2 million a year for 3 or 4 years to play a football player, I'm not sure I'd take it. I wouldn't want to take it for fear that later in life I'd lose my memory. So I'm not sure that the measures that the NFL has taken are actually going to be 100% effective. I know that it helps to limit that, but I'm not so sure. And well, time will tell. If football players continue to have this, if college players in particular have to be protected very carefully about getting multiple concussions. I think the multiple concussion-related dementia, the traumatic brain-related dementia, is something that's been underdiagnosed, but is becoming much more recognized. If your child played high school football and got 3 or 4 concussions, and then, you know, what happens later in life? Most people who play high school and college ball are not going to be making multi-millions of dollars playing professional football. That's just not going to happen. Most of them are going to go on to some other careers, and if they've been damaged, then they have to take that with them. I guess we're talking a little bit about that. So anyway, so the concept here is when we're trying to work with our Alzheimer's patients or multiple infarct dementia, we have to have a very supportive environment. Now, if you're fortunate and you have supportive children and supported family and a supported spouse, you can do this at home. Okay, with 24-hour care, as you get more advanced, you can. Most of us, though, don't have access to that kind of like three children that will stay home with you or something like that, and stay home with you and provide this care. So therefore, we do have institutions like the Kensington, which can provide a very high level of care for our patients, and then be very supportive for them to get the most out of the time they have left on Earth. Now, I see the patients when I live in town here in Sierra Madre, and I walk past the Kensington just about every day as I take my daily walks, and I see the residents doing a little bit of exercise. They're sometimes getting out and doing some walking and things like that with the staff, which is all very good. But it's excellent. I see the program there, and I've looked at the program. It's an excellent program, and it's very supportive. But the real thing is that they've got to be people there, and sometimes there have to be locked doors, or people will wander off. And then, so there's a physical barrier, and then there has to be other barriers present too. You can't have the Alzheimer's patient who was a well-respected businessman being called up and being told that their children are sitting in jails in Arizona or New Mexico, and they need $50,000 to bail them out, or they're gonna, you know, and they're susceptible. They can be picked up. One of the reasons so many scam people call places like Sierra Madre is hoping to get a senior who's got Alzheimer's, doesn't know what they're saying, who will turn around and do what they say, because they will, you know, because of the Alzheimer's disease, they've lost that judgment. So at the Kensington, there's, of course, you can't just call people at the Kensington. You have to go through the staff. You have to see what's going on. We have to be sure that you're the right person to be communicating, not just some stranger from the outside. So that's another level of protection that you do. Now, I personally will write letters for families to take over the financial and medical affairs of the patients as they get older with the Alzheimer's. And I write letters saying they need this, and then it goes before the judge. And usually, as long as the family, oftentimes the person themselves say, yes, I can't do this anymore. My children need to take over. Occasionally, some senior who's made bad judgments will still insist they can. And then we have to get a court order to tell them, no, you cannot send $50,000 to some unknown bank in Uganda or somewhere in Africa, and then they're not going to send you $5 million. It's not going to happen. But the seniors are the ones that are the most vulnerable, and it's really a shame to see somebody who was always an astute, sharp business person reduced to the point where they're being scammed and their accounts are being emptied by people who are just unscrupulous. It's just a shame. Well, if you thought about it, Ronald Reagan, you know, he died of advanced Alzheimer's disease. He was one of the most if you remember the president, I certainly do, Ronald Reagan, I think many of you would, was from California. And I'm very impressed with his ability to give speeches and things like that. But he died of Alzheimer's disease. So he was at one point, arguably one of the most powerful men in the world, if not the most powerful man in the world, reduced at the end to barely being able to recognize Nancy. He did at the very end, just before he died, gave her a quick smile, but that's kind of what the disease does. I don't care how powerful you are, anything like that, you can still get the Alzheimer's and still need the support and care of the loved people around you. Let's see, other forms of dementia that we worry about. We want to make sure we're not missing something. This is why we get the MRI scans. I mean, if you've got a bleed in your brain or a stroke or a brain tumor or things like this, we need to diagnose those and treat those conditions. If you're having epileptic fits, small partial seizures rather than generalized, you may be staring off into space, not answering questions. That's not dementia. That's, you need to be on one of the anticonvulsants. And so that's part of the workup that we do. We look for other things. And there's something else called normal pressure hydrocephalus, which is basically your brain floats. Okay, you have a hard outer skull and you have a brain that floats. Now, there's water constantly being produced and drained so that you can float. Okay, your brain floats. We're sitting here floating in our skulls. Now, it's constantly producing the water, constantly draining the water, and the drains are up at the top. Sometimes these valves stick, they wear out, and then you don't drain and you start to build up more pressure because the water builds and builds and builds. And you start having trouble walking. You forget how to walk. You lose control of your bladder. You keep peeing on yourself, okay? And then you start losing your short-term memory as well. So that's called normal pressure hydrocephalus. Now, we do that we diagnose it through history, but also by getting an MRI scan. And your brain, the inside of the brain looks like big Mickey Mouse ears. Okay, big Mickey Mouse ears are coming up. And that's the space that's been opened by all the pressure from the building up water. So what we do is we have Dr. Withers, our local neurosurgeon at Methodist, or some of the excellent surgeons at Huntington will put a little shunt in, a small little drain, basically drain it into your peritoneum, into your abdomen. And I've seen some remarkable recoveries in patients who we diagnosed with normal pressure hydrocephalus, and we're able to get them back to the point where they're working again. Now, work is a good thing for men in particular. Men who work live longer than men who don't. Women, not so much. If women retire early, they've got family, they've got friends, they've got the grandkids, and they seem to do just fine. But men do better the longer they work. I'm going to try to keep working as long as I can because I know I'll probably live longer that way. Because remember, making 110 is going to be kind of tough. I plan to do it, but you know, I'm pushing for 110. So let's see, the kind of things I think about is eating a lot of salads, a lot of Mediterranean diet. I'm going to start doing a bit more green tea. We'll see if that works out. And then I'm trying to make sure I get enough sleep at night every night. I'm 64 now, so I don't do the night call anymore. I don't go to the ER. I was the stroke director for many years. I've relinquished that to younger people and let the young people in there, I call people in their 30s young. Let them go to the ER at 2 o'clock tomorrow. I don't do that anymore. I get plenty of sleep so I can bathe my brain. As I think I need a good bath and a good workout every night. So that's part of what I do. So I get a good bath brain. A bath for my brain every night. And then I'm eating pretty sensibly now. I'm pretty good about what I'm eating. I'm very careful and try to eat the Mediterranean diet. I'm not a smoker or drinker, never have been. I'm not opposed to people having a little grape juice or a little small amount of wine. I'm not opposed to that, but it's a slippery slope. If you have a weakness for it, don't do it. Just stay away from it. And then, of course, it's about having, if you do, as I said, if you become more impaired, you need to have some people around to support you. Now, also a big important thing with memory loss, it turns out, is hearing. If you're losing your hearing, you're starting to disconnect from people, okay? Hearing is so very, very important to stay connected to people. So if you have started to develop hearing problems, you've got to get hearing aids. You've got to be seen by the hearing doctors, the ear, nose, and throat doctors, etc., and make sure that you can hear people. The loss of hearing could be really critical in terms of keeping your brain and everything else. So hearing is a very, very important factor. Also, there's, I believe very strongly in the use it or lose it philosophy. Use it or lose it. So if you want to keep your brain, use your brain. I use my brain by going to work, talking to people, helping with their neurological, social problems, whatever. We sit and talk things out. I use my brain on a daily basis, and I think that's a good thing, okay? Use it or lose it. If you want to keep your externally strong, you need to get your training in, whether it's with your spouse or your family, but you need to train 3 to 4 times a week to get a little exercise going, you know, for your body. I mean, that's the same thing for the external, you know that, and for the internal and for the brain itself, you need to be thinking. Men don't do well when they just retire, sit on a couch and watch TV. They just generally don't do well that way. They have some great numbers from the post office about the men who retire after 30 years. They've earned their retirement. They've been postmen for 30 years. They've been very busy people walking around everything. They retire, sit on a couch, and they're often dead within a year. But if they keep working, if they go from full-time to part-time, they live much longer. So they come back and work the Christmas shifts. They work some extra shifts. They keep their mind engaged. So men in particular, women not so much. They can do the social activities with each other, with the children, with the grandkids, and they can do fine without. Some men of course, men can change careers. They can come from a high-powered business person to, say, a volunteer at one of the local museums, taking school children through tours of the, I've got one favorite patient of mine who works over the Gene Autry Museum over towards the Griffith Park. And he loves 2 to 3 days a week to take the children and show them all the displays there. And he keeps his mind sharp because they ask all kinds of questions, and that just, you know, the absurd things children would ask. And he's got huge stories. But I'm all in favor of that. It doesn't mean you have to keep doing the same job. You can do something else. But I like to have my men busy. Okay, I like to have the men busy, doing something, voluntary work, going to work at the hardware store because they've always liked gadgets and they've loved to do that kind of, if that's your thing, or something else to do. So I try to keep you going. I personally will try to work as long as I can as a neurologist because I happen to enjoy doing it. But I'll be in a clinic sitting situation. I won't be in the ER at 2 a.m. The young docs are there, and they'll make whatever those decisions are, and that's fine for them. So that's the kind of the concept I do for myself. Is as I said, I'm trying to make 110. Now my dad made 93, mom made 89, but they, as I said, died of heart conditions, and their brains they knew who they were and what they were and who I was, and so, you know, I think it's promising. And of course, my wife's family is those strong Irish people, you know, just comes from a strong Irish stock. And the women never die. They just live to be, what, 100 and something or whatever. And, you know, they live very long lives. So anyway, that's my wife's Irish history. So hopefully we'll be around for another 20 or 30 years here, working with people and working with the community. Now, I've described several different forms of dementia. I've tried to give you some lifestyle hints, things you can do. Things you can think about: the green tea, the Mediterranean diet, which is Mediterranean diet is basically, it's what they eat in southern Italy. They don't have a lot of beef, so they have it just for seasoning and things like that, but they have chicken and they have goats and they have fish, and they eat a lot of fresh vegetables, tomatoes and whatever else. And that's because it's kind of hard and rocky in the south of Italy, and they don't have the access to say the richer foods you'd get in the north. So that's why they call it the Mediterranean diet. And it's proven time and time again to be good for your heart, and because of the multiple infarct dementia, it's good for your brain. Well, I've been chit-chatting here for about 40 minutes or something, right? Haven't I been chit-chatting? Should I open this up for questions? What do you think? Should I do questions? All right. So Meredith here has a question, I think. Meredith, go ahead.
Oh, sorry, I was on mute. I actually had never heard of the normal pressure hydrocephalus.
Yes.
Did I say that right?
You did.
So did you say an MRI diagnosis, that one?
Yeah, you look at an MRI scan or CAT scan. An MRI scan is preferable, but an MRI scan will do it too. That's why we image the brain. And basically, you look like Mickey Mouse ears. You look like you've got these huge areas that should be small, and they look like big Mickey Mouse ears in the middle of the brain, and that's where the fluids build up.
Okay, and so
you put a shunt in, they drill a little hole in the brain, they put a little tube in, and they drain it. Because what happens there is your drains stop working. The valves in your drains wear out with age or whatever, and then they just don't work very much.
Okay. All right. Thank you so much. I appreciate you. Thank you. You've been so informative. I appreciated your whole talk. I really did. Thank you.
Now let's see who else wants to chat. Oh, we have Ophelia. Go ahead. Ophelia, can you chat? Oh no, wait a minute. Can Ophelia undo herself here? We need to let Ophelia, yeah. Ophelia. Okay, go ahead, Ophelia, go ahead.
My main interest was the hereditary part, and you said that from the beginning, it can be hereditary.
Yes, for Alzheimer's disease, yes.
Alzheimer's, and that's where I also get confused. Alzheimer's dementia. Alzheimer's is a dementia. It's
Yeah,
one
it's
of those,
like saying, you drive a car.
okay.
You drive, Alzheimer's is saying you drive a Mercedes, and that's a type of car. And Alzheimer's is a form of dementia. Yeah, go ahead.
I tend to say, because my mom is the youngest of 9 kids. She had dementia. She passed away. And of the other kids, there's 5 of them who have had a child that have dementia now. So that's why I'm asking, is it hereditary? I've got to do all these good things, the right food, the sleep and all that, so not to hopefully avoid it.
Well, one of the things that would be nice to know what kind of dementia she had. Was it multiple infarct from multiple strokes in the brain? And that's avoidable by diet, exercise, blood pressure control, diabetes, very treatable. So if it's a multiple infarct dementia, that's a very treatable cause. You can do a lot by taking very good care of yourself. The Alzheimer's, because it's a mixed bag, most Alzheimer's patients have multiple infarct dementia too, okay? So when you're treating the risk factors, you're trying to say, okay, these are direct things. Just like in order to avoid a heart attack or a stroke, what do? You watch your blood pressure, you watch your blood sugars, you watch your cholesterol through diet and medications, you exercise regularly, you get sleep at night. These are the things that you can make it. It's without a doubt. I firmly believe in this.
Okay.
Oh, also, if you use your brain more, supposedly people who have learned a second language, or people who've done more with their brains in terms of become bridge players and things like that as they get older, taken on some pretty heavy, strenuous stuff, tend to do better, because I think you start with more. Okay. You know, you can build up more. It's like a muscle in a sense. You can build up your brain by doing things. A second language is a wonderful experience for people, and a second culture to learn. But bridge is another way to go, or crossword puzzles. The Queen Elizabeth does crossword puzzles. She's getting, what, is she getting near 100 now?
Yes.
She's getting very close to 100, I think. And she does crossword puzzles. She has her group of crossword, but she does them all the time. That's how she keeps herself fit. I'm not arguing with anybody who makes it.
There are 5 of us in my family who have dementia. And you described one, the frontal. She's 73 and she did all those bad choices or bad decisions. I have a cousin who had the stroke one. He's 86. Yeah. And he's progressing. So that's why I asked, is it hereditary? There's 5 of us of the 9 kids that my mom.
Well, the hereditary part is more the Alzheimer's disease, and that has certain things that are identified. There is a way to kind of sort out some of the dementias clinically through something called a PET scan, PET scan. And basically what they do, to run a PET scan, you give people sugar in water. Yeah. But the sugar's got a small amount of radiation in it, okay? Small amount of radiation in the sugar. It's a little bit hot, in other words, okay? And you have them drink it, and then you see what areas of the brain are active, because the brain loves to use sugar as a food source. So you take it in your mouth, it goes into your stomach, it circulates up into your brain, and they see where the slightly tagged radioactive stuff collects, because it's being used up. Now, somebody with Alzheimer's disease, with the temporal lobes, will have quiet areas where there's just not much sugar uptake, because the temporal lobes aren't working very much. If you have frontal temporal dementia, you have a pattern with the frontal lobe and temporal lobes involved. You know, so they can kind of help sort out some of that through something called a PET scan.
Okay, that's interesting.
Yeah, so that's kind of when you're looking at these different forms. If somebody died of multiple infarct dementia, that's something that's more related to stress factors and everything else. Hypertension, diabetes, all that other stuff. The statistics say that as I said, if you reach 95, you have about a 50% chance of having some form of memory loss or dementia. So the bottom line here is we're hoping for more medical research. We were really hoping for that breakthrough for Alzheimer's. We've had, for example, multiple sclerosis, when I was in med school in the 70s and early 80s, all we had was steroids. We didn't have any other treatments. Now we have 25 different ways to treat multiple sclerosis, 25 different medicines, literally. It's been tremendous where the multiple sclerosis, which was so disabling, is now something that with proper management, oftentimes you won't even know that people have it. They'll be at the store. I'm standing in store getting something at the market, and I realize the chugger is a patient of mine with multiple sclerosis, is doing well. you know, you go to the restaurant, at the waitress or the waiter or the waitress has MS and they're doing well. And, you know, there's plenty of people you won't even know they have MS. But this Alzheimer's disease has been very frustrating for those of us who take care of the patients. It's still, we haven't had that treatment yet. We're hoping, but, you know, as I said, we've been put on the back burner right now by COVID. And we're not getting it. Yeah, go ahead.
Can I ask one more question? I was watching a thing on mushrooms and how they might be starting to test mushrooms with different things like psychologically aside from Alzheimer's. So like shrooming in order to create more brain waves or brain, I don't know what it's called, but in order to create more brain something rather, so that pathways, so that people who have PTSD, have you heard anything about them? And I was trying to Google it, figured out, trying to do that with Alzheimer's people or demented folks. Have you heard anything about that, or where I could research anything about that?
I'm not really familiar with the mushroom use. I mean, I remember mushrooms from undergraduate days, the students who would do mushrooms for psychological. Personally, I didn't do the drugs. I figured life's tough enough without it. So, but I'm well aware that mushrooms have psychedelic features, and they've always had them. But I really can't get up and say, you know, I don't know about mushrooms. I'll have to wait and see on that one. Now, you remember when you're dealing with Alzheimer's patients, there's different forms of Alzheimer's, different forms of memory loss, and it's kind of good to be able to identify what you've got. Oh, sorry, what's your next question? Was that it? Okay, about the mushrooms, okay. Who's next question? We have Monica here.
I do, thank you, Professor. One of the questions I posted, which was private, was I'm realizing there seems to be the ability to have more than one type of dementia.
Yeah.
To help Ophelia, I'm realizing that Alzheimer's seems to be the only one that can be genetic if both parents. But dementia is something that can be caused by simply having strokes, alcohol problems, or head trauma. Is that correct? Or can Alzheimer's also be something that by not eating right can be cause of, you know, getting it? I mean, like, do you understand the question?
Well, I understand the question. That's what we, as I said, you know, when I was in med school, my dean came the first day of class and said, hey, we're going to teach you everything we know about medicine. But unfortunately, half of it is wrong. We don't know which half it is. But we'll teach you what you know, what we know, and then you'll have to go ahead and listen to the research and come back and find out, hey, you were wrong. Well, let's say for an example of that, when we talk about Alzheimer's disease, I was told in med school that the reason you had stomach ulcers is because you were under too much stress. So if you had bad ulcers, you need to divorce your wife, you need to quit your job, go live up in the mountains and drink goat milk, okay? Then, lo and behold, that's what I was taught. That's what they told us. Oh, you've got to stop doing that, and you've got to get rid of that wife of yours and all that stuff. And then, lo and behold, we found out it was due to a bacteria, a particular type of bacteria. So 98%, 97, 90% of ulcers are from a bacteria. And what you really need is triple antibiotics for 2 weeks. Okay, triple antibiotics for 2 weeks versus what we were taught in med school. It's such a radical difference. So I'm waiting for somebody to come up and tell me we're all wrong about Alzheimer's and this is what you need to do. I'm open to that. I'm open to people coming in and saying, okay, that was wrong. We should do this instead. So I'm open to all these kinds of ideas.
Yeah, systematic pruning doesn't necessarily have anything to do with any of it. I mean, like you've mentioned in the past, do puzzles. If you don't use it, you lose it. But it's not necessarily the reason that it's going to start the onset of the problem. It
That's worth the Nobel Prize. If you can tell me why some people develop Alzheimer's and some people don't, and what starts the onset of it, that's a Nobel Prize.
Awesome. Okay.
That would be good.
We don't have it. We just know that there's things that continue to make it worse. We just don't know where it actually stems from or starts.
Yeah, well, the concept is that, you know, we keep making, our cells keep replicating, making new ones, new ones, new ones, new ones. And at a certain point in the brain, you start to screw up. You don't correct it properly. Maybe you can, whereas most of us might make 1 million copies of something, maybe at about 700,000, yours start to misfire. And therefore, you're putting out these abnormalities in the genetic code. And that's why they're looking at the gene pool and saying, well, what's doing that? Now, are there factors which cause the genes to misfire? Are there viruses? Are there whatever? I mean, every now and then somebody's talked about, you know, there's different phases you go. I've been listening to the discussion of Alzheimer's for many years. Is it environmentally induced? Well, you know, there's people who live, you know, there's stress-free lives and whatever still come down with it. Are the genetic indications? I mean, I'm still open to that as to what truly causes one person to fire off and get Alzheimer's and the one next. We just know that age, once you get in the mid-90s, you've got about a 50-50 chance of having memory loss, a form of dementia, which is the greatest risk factor to enjoying your, what they're calling it, they used to call it golden years. I'm not sure what we're calling it now. I mean, but for me, you know, as I said, up until COVID, I was pretty confident that there'd be nothing to get in my way. I've been very cautious with COVID. I still have a deep respect for COVID. But I mean, I was more worried that I'd end up living to 95, and I just don't want to end up without my memory. I mean, this is a very real factor to me. I've got all this longevity in my family. So to me, at 64, I don't want it 30 years from now to not know who my wife is or who my kids are. That's a real risk. That's why I spend time listening to people. I spend time looking at the research because I have a personal interest. Now, my mind's fine now. I like my mind. It's going good. But I'm very concerned about the fact that I'm going to make 95. And am I going to be, which side of the 50-50 am I going to be in? Sorry. Oh, next question, I guess. We got another question? What do we got? Anybody? Questions? I should be doing.
Well,
go ahead.
Just wanted to follow up with that. So you're telling me you don't think that at 98, and I say this because I'm currently with a patient who is 98, you don't think that just age might just cause you to forget something? Do we automatically have to say that?
They have something called benign, benign memory loss, which is a sort of, you don't work quite as well as when you were young. When you were younger, things don't work. I would say to you that things do not work as well at 64 as they worked at 20.
Oh,
I
definitely.
can assure you, one way or another, different things work different ways. The brain matures and ages and becomes a bit more brittle. It doesn't change quite as quickly, which is sometimes good, sometimes bad. You get a little brittle with age. I think that's part of wear and tear. I personally think there is some aging process that goes on. The hopefully is that you've got enough experience and that you can share with people that you're worthwhile to be around. That you can say, I've been through these experiences, let me sit down and help you with. When you talk to younger people who have these nice young brains but really don't have any experience, that you can relate to them and say, I've been through this, I've been through that, this is what happened to me, can you learn from me? And you know, it's sometimes just a pleasure to be able to sit and say, I've been through this 3 times and this is what happened to me. So you share some experience with people. I do believe the brain becomes more brittle as we get older. I think there's a sort of little bit of hardening of the arteries, hardening of this and that. And there's some really exceptional people who are just so at 100 as if they were 20. But most of us are, you know, they slow down a bit with the age. You're not doing that. Now, I've been the one who's always had to write things down my whole life. I don't have one of those look at something, photographic memories. I went to med school with people who could look at a medical text once and photograph it. And they would just, that was all they had to do, read it through once. And then when the test came, they just sort of rattled it, brought it back up and got the question. Whereas I had to kind of force it in, make it learn, did repetitive stuff to create the pathways. People have different ways, but on the other hand, I'm much more social with people. I've been better over the years, working with people, working with doctor groups. I've been head of this, head of that, working with people. I have a lot of, shall we say, social skills. And that's enabled me to be very successful working with the doctors. At the hospital, I ran the stroke program. I ran the rehab unit for a while. I'm joining the medical staff leadership as a secretary treasurer and then moving up to chief of staff. But this kind of social stuff I enjoy doing. And I'm better than most at that, so therefore I get, here I am doing this, Whereas some of my friends who had photographic memories, now that we've been replaced with these cell phones where you can look up anything you want, anytime you want it, that's less than an advantage. I remember when I was still in residency training, before the cell phones, people would have to go to articles, memorize the articles and bring them back to present to the professors. Well, now you just get out your cell phone, you look up the illness, you can look up the latest thing, and you can just read it right then and there. So it's been interesting what technology has done for us. I'm sorry, a bit of a digression. Please, let's go back to, I hope I answered that question. Do we have another? Go ahead. Here we are. Heidi, what you got?
As you're talking about COVID and the PET scans and the food and everything, my mother's mother had Alzheimer's. Her sister had Alzheimer's. My mother has dementia. And she's 90 right now. And it's most in word finding, it's very forgetful from 1 minute to the next day it's all over the place. But the COVID really sped that up, which is very sad because of the socialness, because of the lack of socialness and the lack of being able to exercise and those kinds of things. But as you talk about the genetics of it, I'm someone who has restless leg syndrome. I have seizure disorder. I keep thinking down the road, I'm closer to, that one who's gonna go the same way as my mom, or not, I don't know. But how soon would someone take a PET scan to kind of get an idea of where things are going in terms of their...
Well, I don't jump right to the PET scan. I get the MRI scans first.
Yeah.
I get everybody an MRI or CAT scan. Sometimes people have pacemakers, electronic devices. They can't go for MRI, or they just hate the idea of getting in a small, closed space. They're severely claustrophobic. We get a CAT scan, that's easier. It gives us a lot of the information, not quite the same. So get an MRI, get blood tests first before you jump into the PET scan.
Just do the whole blood thing first, and if there's something
suspicious, it's not that your thyroid is out of whack, or that you've got, you're becoming anemic, or you've got some sort of thing you haven't recognized. So you get a good workup first, an MRI and the blood test first, okay, and then you get a history, obviously, from either your family physician or a neurologist that would talk with you and start discussing these things. PET scans are usually for people where there's a question about early diagnosis or we don't know what's going on. If somebody comes to me at age 90 and I get an MRI and their temporal lobes are shrunken down, classic Alzheimer's patient, I don't turn around and order a PET scan for them. I can see that clinically, I can see all the things all match up. When I get a 40-year-old with memory loss for no good reason, we've done the MRIs and done that's the person I order the PET scan for the first.
Okay.
And I want to know, hey, what's going on with this? What's happening? And then sometimes this frontal temporal dementia, where suddenly this very intelligent person starts acting very inappropriately, doing things that shouldn't be done. I mean, there was a very famous case, well documented, of a gentleman that owned one of the LA teams. And he suddenly was a very astute businessman, doing very, very well. And then he began to lose it, make absurd statements and things like that, and bad business decisions, and eventually he was found with frontal temporal dementia. His wife now has complete custody of him and all his assets. That was that owner of the basketball team. Very controversial because he was saying things that were absurd. But this is a man who before that had been a very sharp businessman. He always said the right thing. That's how he got to where he was. And then he fell from grace. But fortunately, he didn't divorce his wife. He kept his wife. His wife took possession of everything and takes care of him. But I mean, this is how the mighty fall, if you know what I mean.
Sure.
So I have that somehow, but with the coronavirus, we've all got to get through this. We don't want to trip up and not make it through the coronavirus. We've got to make it up. And those of us who are advanced age, it's more of a risk, and then we're trying to take care of ourselves. And I won't claim to know everything about the coronavirus, but I'm not a first responder, but I'm the person they go to in my office after they've had the promise, the neuropathies, and all the neurological complications. If you have a bad case of coronavirus and recover, you have about a 30 to 40% chance of having a neurological disorder as a result.
Oh my goodness.
Neuropathy, memory loss, headaches, all this stuff is about 30 to 40% of them. So needless to say, I'm a fairly busy guy. And I'm taking care of nurses that had it, caught it from work. I'm taking care of all kinds of people that just had it, caught it from work. It's already catching up. And it's still, right? We didn't know about this disease till what, March?
Right.
I mean, and already it's starting to take over a significant part of my practice, just taking care of the post residuals from this. And I don't think it's over unless anybody else thinks it's over. No, I don't think it's over.
I'd like it to be over.
Yeah, so I want everybody to think about, I mean, I know that you're concerned about your family with a family history of Alzheimer's, but let's all make it through this coronavirus thing. Let's stick around so that we can, all be here next year chatting about the latest topic and hoping for the research, right? I mean, we're always hoping that we'll get a treatment for Alzheimer's. There's been some close ones that haven't quite worked out at the last minute. There's a couple of people that think they know what they're doing with Alzheimer's, and they have some things they'd like to present. As I said, it's been a major distraction for the Alzheimer's community to trying to get the research, to finish the research, to get these things papered when all the money's been sucked up for COVID, which is necessary. We all got to live. But I'm just saying, you know, you're trying to get a research project you think is very promising, and suddenly they say, I'm sorry, we've diverted the money to COVID. And I've had a few friends of mine who are advanced in their ages, and they've been in research, and suddenly their budget's dried up. They said, I'm sorry, we need it for COVID right now. Talk to us in a year or two. We'll see then. So, you know, that's a bit of a frustration. Okay, what's the next question? Where are we? Any more? Oh, we have another one here. Go ahead.
Meredith.
Okay, go ahead.
Oops, sorry about that. Sorry, I hate to hog up the time. One more thing about the hydrocephalus.
Normal NPH, normal pressure hydrocephalus, NPH, yeah, go ahead.
Yeah, if the person had an MRI or a CAT scan, like maybe a few years ago, because you know we noticed some changes or whatever, and then they never would the doctors be able to see this easily, or does it develop over time and he should have another MRI maybe, like because it's been a few years? Or
well,
like,
if you're concerned about the diagnosis, which you have gait problems, you're peeing on yourself,
yes,
and you're having short-term memory loss, you just get another CAT scan or MRI scan and you can take another look.
Okay.
And see what's going on there, okay?
And it's kind of easy to see, like you said.
Oh, in advanced stages, yes, it's pretty easy to see.
Okay.
Now, sometimes it's a little bit tricky because you could have the shrinkage of the brain that sometimes mimics it. So you do another test. And the test is you put a needle in the lower back and inject in a radioactive material into the spinal column, like, you know, like to do epidurals for women when they're having babies.
Mm-hmm.
Only you inject in a contrast material that has a little bit of radiation, and then you see how it goes up the spine and floats around and how it drains. Does it go through the drains or does it collect? You know what I mean? Stop up. Mm-hmm. So if it goes up as it should to the top, moves up, goes around and drains normally, okay, then you're fine. In other words, it's a way of checking your drains. And if it doesn't, now what happens, you get the injection and then you come back and lay on a scanner, which is in radiology. You just lay there for about half an hour for 5 days in a row, and they check the course of the radioactively tagged materials. So it's not, once you get the injection, it's nothing invasive from that. You just have to lay on a table that scans your brain, and then it just kind of measures how it's drifting up.
If and last question, thank you, but if that is the diagnosis and then they put in the drip, the brain may have suffered additional problems in the meantime, because if this is the diagnosis, maybe because there weren't the drain hadn't been put in the first place. And can you get Taz with the, sorry.
One other question. You're wondering, I mean, it's always best to catch these things early rather than late. That's what I'm trying to say. I'm sorry. If you've got cancer, we want to catch it early. If you've got a sore throat, we want to catch it early. It always works better when you catch it earlier rather than late. But sometimes it takes time to manifest. Okay, thank you so much. I appreciate your time. Sure. All right. Do we have any more questions here? Sorry, I got to go back to the... And let me see, I got... oh, here we are. Are there any more questions anybody wanted to ask? Alrighty.
Well, it's Amber at Kensington. I just wanted to thank you so much for all your time that you spent with us and really giving in-depth information. It's much appreciated. Certainly. Okay, guys. Alrighty. Thank you very much. My offices are in Arcadia on First Avenue. I'm a neurologist and on First Avenue in Arcadia. All right. I'll send everyone this virtual event, so that I know there was a lot of information. If they just want, I saw a lot of people taking notes, so I'll make sure that I send it out and with the doctor's information too. Okay. All right. Thank you, everybody. Thank you. Bye bye.